Welcome to the Statesman Talk. I'm your host, Anna Chaudhary. Our guest for today is an author and an AAP leader. He's considered as the brainchild behind a lot of AAP's policies. He leads JPAL's efforts to build partnerships with policymakers in the region to ensure that policy is driven by evidence and effective programs are scaled up. Mr. Jasmine Shah, welcome to our podcast.
Thank you, my pleasure.
Sir, could you please tell us a little about what prompted you to join public policy and politics?
I'll have to go back, I think, to 2007. I had graduated from IIT Madras. I was working in the corporate sector, was having a nice, happy life. But somewhere, I traveled a lot in the country in those years. And there was an immediate disconnect that made me unhappy. And which was that, while, like most of those who graduate from these elite institutions feel that we can compete with the best in the world, and that was the time of IT revolution, post liberalization era. But when you look at the state of our country, when you look at the state of our governance, which is what majority of Indians have to live with every day, it's actually very distressing. We are, like most of our states have third world governance, and somehow I felt that disconnect was too strong.
And there
and
are
I
two
felt
Indias.
and there are two Indias, and I talk about it that there are two Indias. I mean, there is a rural and urban, but I feel even within urban, the quality of life that, let's say, the bottom 2/3 of the population lives and what the top 1/3 lives is very, very
Completely
different.
True.
And I felt that, a lot of us are into this cynical mode and we keep cribbing and we keep complaining. And I felt that probably I should be part of the solution.
That's been an attitude, actually.
And I felt I should be part of the solution. Agar itna hi hai, to let's, let the people who are very passionate about public service or improved governance should be a part of the solution.
Contribute to the change.
So I decided that, and it's been a journey. I worked for the first 10 years in the non-profit sector, in the development sector. But from the beginning, I was very clear that the problem of the scale that India has, and we are a huge nation, obviously 1.4 billion people, you cannot fix it by working in a small organization or a non-profit. You have to work in the government. So from the very beginning, I was fascinated by public policy as an instrument or a lever for change. And I was also very clear that policy and politics are the two sides of the same coin, because it is your political ideology that defines what kind of policies you come up with. And I was very clear. I do not know where that clarity came from when I was young. But मुझे clear था कि अगर सरकारों में political will ही नहीं है to work on issues like health and education, तो कौन ठीक करेगा? How will it? It'll automatically not change, because the ideas are all there. You have brilliant non-profits. Our non-profits are going around the world and giving advice and solutions. तो ये था, and after working for 10 years, and obviously 2012-13, we know the Anna Andolan happened and Aam Aadmi Party was formed, and suddenly out of the blue there is this party of passionate, educated, thoroughly non-corrupt individuals who wanted to come in the government and make a difference. And like millions across the country, I was also watching let's see what happens of this experiment. And suddenly you realize a miracle happens in the 2015 election, 67 out of 70 seats. And not just winning the elections, but I think the kind of priorities that it defined for itself from year one. I talk about it in the book, that immediately after coming to power, one of the first decisions that the government took was to double its education budget, to increase its health budget by 50%. Now, by that time, I had worked for around a decade in the development sector to know that this is not an easy decision.
Of course.
Only a government that is serious about these priorities will take it. And that's when I went and actually reached out through my organization to work with Delhi government. I met Mr. Sisodia. I talk about that meeting in this book, but my journey began from there. And, I just feel that I found a home and a group of colleagues and people who were as passionate about changing the country for the better by improving the lives of the Aam Aadmi as I have seen. Probably I've not seen such people anywhere in my life, so I was very happy to associate with them.
Yeah, and in that, could you tell us a little about that one particular meeting? Because you went in to actually pitch public policy.
Yeah.
And I believe you were heading JPAL at that point of time.
Yeah.
So what happened? What actually convinced you that, okay, I have to be on the inside now?
So at that time, I was the South Asia policy head of this organization called Jameel Poverty Action Lab, JPAL. People popularly know it as the organization that was founded by two Nobel laureates, Professor Abhijit Banerjee and Esther Duflo. They have amongst the foremost development economists
Extremely
of our time.
respected, yes.
And at that time, I was working with 10 state governments, advising them on a range of social policies, primarily health, education, and stuff. So in 2015, when Mr. Sisodia, in his first budget, he was also the finance minister, announced that we are doubling the education budget. Now, I was working with 10 state governments and I had seen that बोलने के लिए तो बहुत लोग बोलते हैं, but when you go and meet them, you understand the seriousness, most of the time. And I have seen in almost, I would say, dozens and dozens of meetings, even if you come with the best of ideas, a mid-level bureaucrat, not even the secretary or principal secretary will hear you, some director level IS officer will hear you. We'll give half an hour, 45 minutes. और उसके बाद, there'll be a long phase of file movement, ये वो करेंगे. Minister will come in at the final stage when everything is decided and for only 5 minutes for a nice photo of MOU sign किया है या फिर ribbon काटना है and something like that. In Delhi, when this was announced, I just approached, at that time Atishi ji was the advisor to the education minister. I approached her and she immediately understood, JPAL is a renowned organization. We are very serious about the work that we were doing. So she set up a meeting with the education minister. That meeting, and I show up, I was like, probably the education minister wants to meet. They had called the finance secretary of the government, the education secretary of the government, the advisor to education minister and the minister. Like, this is the A team. There was no B or C team that was coming to meet JPAL. The A team was ready and they spent 3 hours listening to us. We went there to say that, okay, you have increased your budget, but you should not be wasting it. You should know what are the right programs to invest it in. And we have the evidence and knowledge from around the world of what works and what doesn't work. And the amount of patient hearing that was given to us, and most of the questions were asked by Mr. Sisodia, the education minister. So here was a man who did not have a grand vision. He very well appreciated the nuts and bolts. कि नहीं, लेकिन teachers को ये पसंद आएगा, teachers की ये issues हो सकती हैं, principals may react in this way. So I was completely blown away in that 1 3-hour meeting. And for me, that was enough to convince me that these people really wanted to do something that has never been done in India, which is to not just, जो बोलते हैं ना, 4-5 स्कूलों को नहीं चमकाना था, एक गवर्नमेंट स्कूल एजुकेशन सिस्टम को हमें ट्रांसफॉर्म करना था. एंड
from the grassroots.
From the grassroots, from like each and every school. Today, we confidently say that walk into any of our 1,000 plus government schools and talk to any teacher principal और पूछो कि कुछ बदलाव हुआ है नहीं हुआ, and you will know the story of it. But that was my beginning. And over the course of that particular year, while I was still with JPAL, I had many such interactions and I could see that जो बातें हुई थी वो translate हो रही है ground पे. ये file के बहाने पे we are not losing too much of time. And at the end of 1 year, when Mr. Sisodia said that, look, we need more committed, educated people like you inside the government, I mean, I couldn't say no.
So what was your intent while actually writing this book? What inspired you, or when did you decide that you have to write a book that actually talks about certain subjects? And what is also your target outreach that you're looking at?
See, I chose to write this book for 2 reasons primarily. First, lot of, when AAP came to power in 2015, and I told about this historic mandate, 67 out of 70 seats, no political party in history of India has won that kind of a mandate. And people across the country, and I would say Indians even outside, were following this new experiment in politics. And the reason was because there's a lot of hope that, these kind of people, educated people with no political background, all professionals. Mr. Kejriwal was an ex-IRS officer. Mr. Sisodia was a journalist. Atishi was a teacher and, a graduate from Cambridge and St. Stephen's and stuff. When these kind of people come into government, some magic will happen. And the magic, the word that was used, I remember, was Vyavastha Parivartan. That, we are not here to say that, we'll fix education and health alone or anything of that nature. We will transform how government functions for an average Aam Aadmi. No less than, I don't think a grander promise has been made.
That was a mighty promise at that point.
It was a mighty promise. And now we are 10 years after that. And I have seen this internal journey from, being part of the government. And I feel that journey and that story hasn't been told yet. A lot of people who had invested their emotions with AAP need to know what happened when these people were in the government for 10 years. And the reason I say this is because I feel the mass media is the least credible medium to convey that story. Most of the times when you hear about Aam Aadmi Party in mass media, it's because jail chale gaye, ek inquiry aa gayi, somebody is fighting, there's some agitation, protest. So the noise of the politics around AAP was so much that the real story, and I would feel the more exciting story of transformation of almost the birth of a new model of governance was not being communicated well. So I felt I have been an insider. I've had the privilege to work directly under Mr. Arvind Kejriwal for so many years with Mr. Sisodia. And I've seen all these reforms unfold before my eyes. I felt a true accounting of these reforms needed to be told. And I am glad I found the time and the space to do so. The second reason is also a story. It's not just saying ki humne ye kiya. I feel in India we are headed towards a very dangerous path. And that path is, like India wants to become a developed nation. Everybody talks about Viksit Bharat.
And we have the largest youth population.
We have the largest youth population. We have this demographic dividend advantage. But we are completely, I would say, we are walking towards a very dangerous path which will never take us there. And, our priorities are misplaced. Today, if you go to any other government school in India, and forget about any, like go to states where parties have been ruling for 25, 30 years, Madhya Pradesh, Gujarat. Not a single government school where you will feel proud taking somebody and showcasing that, oh, such a great. So we have still not invested in our health. We've still not invested in education. So, and at the same time, the inequality is increasing. For the last 2 decades, the per capita income of India has stagnated at around 160. We are amongst the worst performers in the Human Development Index, in the Gender Gap Index, in the Hunger Index. So the question the second reason why I wrote this book is to put out Delhi model of governance as a story of hope, as a blueprint that is not just Delhi mein to hua hi hua, but possibly this shows us what needs to happen in other states and probably the rest of the nation if we ever, are to come close to the idea of being a developed nation.
There's also a study in your book which basically mentions something to the tune of that after being freed from the British, after the British Raj, we basically have not been as unequal
Yes.
as we are now.
Yes. So we are in our 78th year of independence, and I cite the work of the noted French economist Thomas Piketty. He's widely known as one of the most knowledgeable people on global inequality, and he's done his research center has done this study mapping inequality in India for the past 100 years. And it's stark, the curves that you see, that how much proportion of the wealth is there with the top 1%, 10%, and how much is there with the bottom 50%. And somewhere I think in the late 80s or early 90s, close to when the liberalization happened, the curve started diverging. And for the past 30 years, the share of the wealth that the top 1 and the top 10% have is growing astronomically. It's exponentially. And the bottom 40-50%, and it's reached, that gap has become so wide that it's almost saying कि Britishers ने भी हमें इतना नहीं लूटा था जितना आज की सरकारें हमें लूट रही है. The kind of giveaways that we are giving to our corporates and the industrialists, and the idea is that no, if they become wealthy, the trickle-down economics model that I talk about, it's completely a flawed idea. Gujarat has been doing it for the past 30 years. Disastrous outcomes for the Aam Aadmi of Gujarat. I'll not talk about the top few corporate groups who have benefited at the cost of everyone else. Across the country, you see the inequality is increasing. And that is why I pitch Delhi model as the antidote to this kind of a development model, which is only growing inequality more.
Also, I'd like to ask you on that note that do you think that there's hope for us because considering that Aam Aadmi Party is a regional party, we are
a national party.
A national party, but has not been given the opportunity on a national level.
Yeah.
Also, if you consider the fact that what works in Delhi, because Delhi has its own unique challenges, of course, but also it's a completely different state than the rest of India, say Bihar or Northeast. Those regions have their own set of challenges. Do you think that the Delhi model would actually be a fair comparison? And do you think that would be effective in these other states?
So I have answered this question sector by sector in my book. One part of the book, so I've taken 6 sectors in this book: education, health, air pollution, transport, water, and electricity. I've talked about what we have done in Delhi, but each chapter ends with a section on how do you leverage the principles of the Delhi model for a national reform roadmap. And I genuinely believe that what we have done in Delhi is actually a governance model. You cannot call it a governance model if it cannot be applied elsewhere. Of course, the exact formulation of what reforms will be needed in Uttar Pradesh or Bihar or maybe even in Maharashtra will change. But this idea that you need to invest far more into education and health, the fact that you need to strengthen the public healthcare system than just having this health insurance on the name of Ayushman and hope that everybody will be better off. So some of these are fundamental principles. Many experts have spoken about it before, but in Delhi we have actually done this. So the credibility of the fact that many of these reforms can be brought about in other states comes from the fact that we have done it in Delhi. I feel the other state that Aam Aadmi Party rules, Punjab, the success of these reforms over 5 to 10 year period will be, I would say, another shot in the arm for the Delhi model because it's the same party in power. So yes, it is eminently doable. The constraint is not a big state or a small state. The constraint is political will. The constraint is political ideology. Will we see any other political party in India that will have, I would say, the courage to spend 40% of its budget in health and education? Today, across India, government spend not more than 15-20%. Aam Aadmi Party spends 25% in education and 15% of its budget in health year on year, every year for the last 10 years. That is unprecedented. That requires political will. Formulation of ye reform karna hai, wo karna hai, that can change state to state. But some of these, I think, broader principles are applicable everywhere.
And also, so Mr. Sisodia talks about his speech. In his speech, actually talks about the trickle-up economics. In contrast to the trickle-down model, as you mentioned, is the Gujarat model. So would you please tell us a little more about that?
Yeah.
Also, I have a follow-up question. The trickle-down or the trickle-up model doesn't seem to be really reaching the middleman, or so it seems. That we don't have a lot of of course you see the middle, you can see differences in government schools and government hospitals, but when it comes to the middleman, we don't really see this trickling up or trickling down either way.
Middle classes you mean, not the middleman.
Yeah,
So let me first define. Your first question is what is trickle down, because it may seem too much of jargon, but I think it's very simple. For decades, governments in India, and I talk about both Congress-led governments and BJP-led governments, have believed that the surest way to grow a nation is to give a lot of freebies, give a lot of tax cuts, loan waivers to the rich business houses. And the idea is that agar growth nahi hoga, if the GDP doesn't grow and if these big businesses don't prosper, to naukriyan kaise aayegi? How will the development reach the ground? So the idea is that if they become prosperous, drop by drop, that prosperity will reach the next tier, and maybe after a few generations, everybody will be better off. It's an interesting idea, but
we know it doesn't work.
It doesn't work. Nowhere in the world has it worked, and there are studies after studies. US is a huge failure of trickle down because the inequality there has increased. Minimum wages have stagnated. The average Aam Aadmi, and I'm talking about somebody who's near the average per capita income, hasn't improved. The trickle up. The word is not something that we have used before. We have learned it. I mean, I think one of the first people to use it was a Nobel laureate, Professor Joseph Stiglitz at Columbia University, and he talks that the surest way to grow an economy, you want everybody to be prosperous, first make the middle classes and the lower classes prosperous. And middle classes is important because there's a huge middle that most of the countries have. Invest in their education. Like if you're talking about a poor child, obviously has lesser resources, but if he does not get good education also, how will he try and compete with, let's say, a richer child? So invest in education, invest in infrastructure, invest in things that directly empower the middle and the lower classes, because if they are highly skilled, if they are healthy, and if they have higher spending power, then automatically there is demand in the economy. I mean, that is one of the things that when we give a lot of free benefits to the people of Delhi, it goes back to the economy. They spend on day-to-day things, and finally that's how the economy sustains.
Yeah, you've also been accused of the freebie.
We'll come to that, but I want to address the fact that middle classes don't benefit. I don't think that is true, because a lot of the things that we have done in Delhi, for example, our free electricity scheme. I mean, middle class is, let's say, around 50%, right? So free electricity scheme, around 70% of people of Delhi get free electricity. Right, another 20% get partially subsidized. So 90% is covered. I'm sure the middle class is covered in that. Today, because of all our policies, Delhi has the lowest inflation in the entire country. Doesn't the middle class benefit? They benefit. 2.2% inflation is better than many developed countries in the world. I mean, the rest of India is at 5%. So Delhi, we have made the public transport. We have really invested in our public transport system. Today, Delhi's metro network has doubled, more than doubled in the last 10 years. We have the highest number of public buses. We have electric buses. Delhi gives the most generous subsidies on electric vehicles. That has finally impacted pollution. We provide 24/7 electricity. A idea that you have to make sure that you have a world-class grid so that you can provide 24/7 electricity is something which parties do not believe in. Nobody invests the amount of sums that we have invested. आज 24 घंटे बिजली मिल रही है, मतलब I'm sure the middle classes are happy that 24 घंटे बिजली मिल रही है.
That's
You
true.
get
The power
affordable.
cuts for sure. Looking back, say 10 years, there was starkly, huge difference in power cuts. Now it's not an issue in Delhi anymore.
No, you don't see any inverters, diesel.
Yeah, true. It's not
Earlier,
needed.
anywhere else in India, you buy a house or if you rent a house, you'll ask कि नहीं यहाँ पे inverter लगा है कि नहीं, क्या society में diesel Today you don't ask these questions in Delhi. Nobody asks, not even businesses, right? So, but you go just outside Delhi, go to Gurgaon, go to Faridabad, Noida, the biggest societies which sell flats in crores of rupees will have a full-time DG backup. In fact, they run on DG backup throughout the day. So that's the difference.
In your book, you've mentioned that an AIMS, a single bed costs about 1.5 CR, used to. How did you manage to bring this down to 30 lakh? Because the difference is huge.
Yeah. So, see, this is where, a lot of the times question is asked that, oh, you provide all these benefits, the government will become bankrupt. That is one of the charges.
How do you plan to sustain these changes?
There are two ways in which, when the AAP government came to power, right, we knew that we wanted to drastically improve the quality of lives of the Aam Aadmi. And for that, we need to create some fiscal space. So we worked on two broader strategies. One is to increase the revenues of the government, right? So, and we've done a lot of steps there. But eventually, in the last 10 years, Delhi's budget has increased by 2.5 times. It's unprecedented. Delhi's budget has never seen this kind of a growth. We were at 30,000 crores annual budget in 2015. Today, we are at 75,000 crores. The second lever or dimension on which we have worked is cutting down all the inefficient spending in the government. I cannot tell you, I have worked within the government, the amount of wasteful expenditure that happens. अगर कोई भी बोल देता है कि government के पास पैसा नहीं है, I mean, that person is lying.
Please give some examples.
I will give you this example, and I think the classic example, I'll come to hospital, but I'll tell you the example of Mohalla clinics first. Think about it. I mean, earlier, before Aam Aadmi Party came to power, the way in which the Delhi government used to provide primary healthcare to the citizens of Delhi is through this body or through this idea called dispensaries. Okay, government dispensaries. ये क्या होती थी? These were multi-storied concrete structures, जिसमें maybe around 22 staff, 1 or 2 doctors, rest other paramedical staff would be there. Half of the time when you go to these, first of all, these structures would cost 5 crores to construct. 20-25 staff, you can think about, these are proper sarkari staff, unki salaries kya hogi.
And also the time needed to actually construct these.
Yeah, that is definitely true. But when you go them, most of the time they are either not there, not available. The tests are not working. Sara in-house hota tha. The medicines are not available. So you're actually not providing any, like it's a pure expenditure without any benefit. Mohalla clinic does all the same things. Eventually we realize that you have to cut down any government service to its core essential. Essential is for primary healthcare, you need a doctor, you need a compounder. That's how most middle classes have, you go to your neighborhood clinic, ek doctor hai, compounder hai.
Family doctors.
Family doctor, physician idea. So we actually did that. We said we cut out all the system. We created a small 400 square feet porta cabin idea, air conditioned clinic, but built at 20 lakhs. 5 crores se 20 lakhs mein hum leke aaye. So this is not even 10%. We are talking about 5%, 95% cost saving in the capital cost. We cut down this sarkari staff. All of the staff at Mohalla Clinic are empaneled private staff. Okay, so an MBBS doctor may run their own clinic privately, but for 6 hours a day, they have a shift in Mohalla Clinic. And they get paid per patient. So जिस दिन आपके patient ही नहीं आया, if you don't show up at the clinic, you don't get paid. So, the incentive structure had to be changed. So that is the savings there. Now, hospitals is a very interesting question that you ask. Typically, a government hospital in India is costed, AIMS is costed at 1.5 crore per bed. So if you're creating let's say 100 bed AIMS anywhere in India, you will budget 150 crores. But if it's a regular government hospital, non-air conditioned, it is still built at 100 crores. Now, we had the good fortune of having Mr. Satyendra Jain as our health minister, who's a professional architect. And the first time when he started drawing up plans and he was told, अच्छा सर ये 600 बेड का नहीं 200 बेड का हॉस्पिटल है तो it will take 200 crores. And he started thinking कि 1 crore per bed in a government non-air conditioned hospital, if I take a flat in South Delhi, वो भी 1 crore में मतलब I get a proper flat there.
For
So
life, that you can
yeah.
actually...
So what is really happening there? So when he started looking at it, he saw that the kind of rooms that were built for the staff, you know, the director of the hospital had half a floor to himself. The supporting senior doctors had like literally, you know, 5-6 cabins. You know, सब आलीशान level के जी रहे थे. The actual space allocated to beds and to the patients were very small. So he completely changed the plan. He added 400 beds, I remember. 200 crore के hospital को he made it 200 bedded hospital, he made it 600 bed, and he increased the cost by around 40-50 crores. But he just completely changed the layouts and plans. And that is how the cost came to 30 lakh rupees per bed. And since then, that has become a benchmark of Delhi government. Any outside government you go to would never put... Have you ever thought about a minister sitting with all the team of architects and actually, you know, square feet by square feet signing off and vetting and saying कि नहीं ये wasteful expenditure है, ये जायज expenditure है. That is what our government did.
So that is the success story. I'd also like to ask you about what happened during COVID. What are your key learnings that what you could do better? Because it was, of course, it's something that the world had never seen in the past some time.
Yeah.
But what do you think could have been done better when it comes to COVID? Because a
So-
lot of people suffered and a lot of people lost their lives.
No,
and their loved
absolutely.
ones.
Absolutely did. And I think COVID was the kind of a pandemic that the world had never expected. The world was not prepared for. And anywhere in India, including in Delhi, our health systems collapsed at the peak of the second wave. You know, I would still say that Delhi managed throughout the entire COVID phase far better than many other state governments. But at the peak of second wave, the demand for tertiary care services outstripped supply. I mean, our mohalla clinics are primary care, right? I mean, and COVID, by the time the second wave came, everybody knew that if you have minor symptoms, you can get treated at home.
Yes.
You don't need primary care so much. But what you needed was tertiary care. Like if you really were ill, you needed a hospital. Now hospitals take time to construct. You know, when Delhi came, when AAP government came to power, and I talk about it in the book, in the last 65 years of independence, only 9,500 beds were created in the Delhi government hospitals. In the last 10 years, we have added around 50% capacity. We are at around 14,500 as on date, or 13,500. But that's not all. We have already, immediately after COVID, we realized how huge the gap was. We have sanctioned and we are at an advanced stage of adding 16,000 more beds to the Delhi government system. So, जब हमें system मिली थी 2015 में, we were around 10,000 beds. In another 2 years, all these plans are going to finally culminate. So, we'll have 30,000 beds in Delhi. I think in per capita terms, Delhi will probably have higher number of beds than most other international cities. India में तो है ही, but we feel that the supply side needed to augment far more, and that takes time, but we are on it now.
So, you know, you spoke about electric vehicles and promoting EVs, building signages, beautifying the city. But what is happening with the Delhi roads?
No,
We have in South, if you look at South
Yeah,
Delhi itself, you know, roads are constantly being built and broken, and built and broken. So they're constantly broken.
Yeah.
Why are the roads never ever getting built? And what is the reason that we cannot have roads that are at par with, say, in the US or Europe? Why do they need to keep on getting rebuilt every season, every monsoon? They need to be rebuilt.
No, so it's a very apt question. This is one thing that we struggled with as to how is it that the government, you know, attracts the kind of contractors that it does. That roads need to be rebuilt not every year, but once every 2 to 3 years का होता है. You know, they call it re-layering. You know, basically
There's some roads that are constantly in construction.
True. No, true. So, you know, the biggest learning that we've had is that, and especially for a national capital like Delhi, you need to have large professional contractors and who will build roads to international standards. You know, laying of roads is not the answer. The problem is that our roads are first of all designed in a very poor manner. You know, these are normally designed by in-house engineers or PWD who don't know what are the global standards and stuff. So I remember in 2016 or 17, we started this entire idea of building world-class roads in Delhi. So far, and I think till 2020, we built 16 kilometers of these roads on a pilot basis. Actually, if you go to Lodi Road or Moti Nagar, you will see some of these roads which has beautiful pedestrian pathways, bicycling lanes. The idea there is you redesign the road from scratch, but then you give the tender for 10 years to one contractor. They build the roads as per very high standards, but they have to maintain it for 10 years.
Accountability basically is missing.
ऐसे नहीं कि आपने एक रोड बना दिया and your term is ended, आपको पैसा मिल गया, आप चले जाओ. So we are the first one who piloted this idea that you give a road project for 10 years. So you build the road and you maintain it for 10 years. If you not built it well, it's from your own money that you will spend on it. But that requires a completely different way of tendering and contracting. We defined, I remember in last year's budget, 2023 budget, we said that, we've done all the hard work, the spade work. 1,400 kilometers of road, all the major roads of Delhi, we have created a project at 19,000 crores was the outlay. We said we'll spend it over 10 years because you have to pay an annual sum. And we said that not everything will be given to the contractor. You pay only 40% of the initial sum. The remaining will be phased over 10 years. So they stay accountable. Over the last 1.5 years, this project has seen a delay. And I'll come to it because a lot has happened in the last 1.5 years, including top 3-4 people of our party and the government being put in jail. So there has been some delay in that project, but that project is very much a part of a vision. I can promise you on your show that the moment AAP comes to power, one of the top 3 priorities is to fix the roads of Delhi in a manner that is comparable to the national standards. We have the blueprint, we know what needs to be done, and thankfully we have seen the worst phase, where all our leaders were jailed in a fake case. Everybody is out. Slowly and steadily, all the works of Delhi are coming back on track. Roads is going to be one of our top priorities.
So also elections around the corner, and why should the voter of Delhi vote for AAP, considering the challenges actually remain the same, which is that the LG, may not cooperate on a lot of matters, which is what's been happening, and the center is BJP, and so those challenges will remain the same. How will AAP actually tackle those issues and deliver on their promise and deliver more to the voters of Delhi?
I think the one message that if I have to give from both working in Delhi government and writing this book is that nothing matters more than political intent and political will. If you have a government that truly wants to work for the people, it will find a way.
So, but there have been challenges. Just the will has been there. That's evident, with AAP. There's no question about it. But apart from the will, the reasons that AAP could not deliver on certain promises is because of the LG and
so I'll come to it. Now, I think that needs to be remembered first and foremost, that if you do not have a government that has the right priorities and has shown a track record of delivery, we have said that we will, fix schools, we'll fix healthcare, 24/7 electricity. We have said we will give you drinking water from the taps, which today, by the way, we have inaugurated a pilot in Delhi. So we have a track record of delivery. As far as LG coming into the picture, see, the last 4 to 5 years, there were a few obstacles, which today they are not there. And that is why tomorrow is going to be far more optimistic. And that is my message. We had 2 years we lost due to Corona, right? Where the entire focus of the government was only fighting this health pandemic. So many development, many infra projects took a backseat. The last 1 year, especially, I'll call out as the toughest phase for the Aam Aadmi Party government in Delhi, as well as for Aam Aadmi Party as a political party. There was an attempt to finish off Aam Aadmi Party. No party in India's political history has seen this kind of vendetta as we have seen against us, where the top 4 leaders have been put in jail. Now, what has happened to that case? That case is dead. That case is cold. Everybody is out on bail, and because everybody is out on bail, you see in the last 2 to 3 months, literally everything is coming back on track. Actually, a lot of roads reconstruction is going on right now in Delhi as we speak. Today, we inaugurated our water project. The Mahila Samman Yojana that we call the cash transfer scheme for the women has been cleared by the cabinet. The EV policy has been renewed. So all of this is happening because there is a government with will. Yes, there will be obstacles. We are not saying there will be no obstacles. I mean, unfortunately, center, rather than working in a collaborative or a cooperative federalism mode, wants to stop the work of every opposition government. But we have still worked in the last 10 years. The worst is behind us. I think the future only will augur well for the people of Delhi.
So also coming to EV and air pollution. So the odd and even scheme is something that is, of course, it's for emergency measures only. But do you think that the impact that's actually happening is justified because it inconveniences people? Your public transport, when it comes to Uber, Ola, the rates go up,
Yeah.
and the common man has to figure out their,
See, it's a valid question, and that's why I make the point in the book also, in which Aam Aadmi Party always says that the odd even scheme is an emergency measure. Only when your AQI goes above 500 and you are facing long days. I mean, if it's just for a couple of days, then you don't need to put odd even. But if for a longer period, the word emergency has to be used with certain seriousness. When somebody in your family faces a health emergency, you stop doing business
of
as
course,
usual.
yes.
So it's the same thing. If a city is going through a health emergency, everybody has to bear some pain. The question is it worth it? And I have cited work that is done by leading academics and economists to show that odd even scheme has an impact of around 10 to 13% on the air pollution. Is that enough? My answer typically is that tell me one other measure that in one shot reduces the pollution by 10%. I mean, pollution is such a complex subject that you need to do number of things. And if there is one measure that can reduce pollution by 10% in a time of emergency, I think it is the responsibility of the government to go ahead and implement it. And if you look at the track record, we have not implemented it left, right, and center. In the last 10 years, we've implemented it thrice.
So also, understood when it comes to it's an emergency measure, but also considering the fact that, every year the pollution keeps on going up. Why is it not being tackled? Because air pollution remains a serious concern for Delhi.
It remains a serious concern.
And I understand that there is also, it's not just a Delhi problem, it's actually it's a regional issue where you have Haryana, you have, Uttar Pradesh that contribute to it. And I believe that Delhi actually, the pollution that's happening because in Delhi itself is about 30%.
That's right. So
contributing.
But first let me correct you that pollution in Delhi is not increasing every year. If you look at the average PM 2.5 levels in Delhi over the last 10 years, and this is data from the Central Pollution Control Board, it has gone down by 40 to 45%.
Why does it feel like it?
No, so I'll tell you why. Because we are right now sitting in Delhi in December. The months of November and December are there are a lot of factors that collude in the months of November and December. Crop stubble is one. Adverse environmental factors. If you look outside, there is hardly a wind blowing. So the wind speed goes down. There's something called temperature inversion. So whatever pollution that you create in Delhi just stays in Delhi. The wind doesn't disperse it.
Is there a solution?
I'm coming to it. First and foremost, as I said, there is a larger silver lining that from January to October, if you look at it, pollution levels have come down. Okay? The month of November and December, still it is a severe problem. But our pollution average AQI, if it was, let's say 400, it's now come to 300 or 250, which is still high. Even the average levels are high. Now, what has contributed to this 40% decline? Because, and I make the case in this book, Delhi government under Aam Aadmi Party is the only government that is seriously working on addressing pollution. I believe the rest of our states, and especially BJP because it's ruling at the center and Haryana and UP, they have not done one thing that they can claim to have reduced pollution in Delhi. What has AAP done? We've shut down all our thermal power plants. These are all things which happened in last 10 years. And these are measures that none of the surrounding states have taken. We shut down our thermal power plants. We have moved all our industries from polluting fuels, which were coal earlier, to clean pipe natural gas. We provide 24/7 electricity. You don't see any diesel generators. You go outside Delhi, everything is running on diesel generators. We have inducted electric buses. 2,000 electric buses today run in Delhi, which is the highest in India and the third highest in the world. You just look at outside Delhi, immediately outside Delhi in NCR area, not a single electric bus that runs. So number of such measures. We've improved our green cover and there are a lot of other measures that we are working on. That's the reason that pollution 40% come hua hai. Now your question is, what else can be done? What needs to be done? And the answer lies in one statistic you quoted, that studies after studies show that Delhi, the local sources of pollution within Delhi contribute to only 30% of Delhi's pollution. The remaining 70% is happening outside. So ask any commonsensical person, आप 30% पे ही काम करते रहोगे, फोकस करते रहोगे या 70% की भी बात करोगे? Why is it that in the entire pollution period, let's say October, November, December, the Prime Minister never addresses the nation once? He never talks about what is his plan to bring 4 states together, have a common plan, make sure that all the polluting industries are shut down, make sure that electric buses become the norm everywhere. They never talk about it.
Why do you think that is?
I believe it is very convenient that when it comes to Delhi, it is very convenient politically to blame Arvind Kejriwal and Aam Aadmi Party. And probably I believe BJP believes कि pollution पे काम करने से या किसी भी चीज़ पे काम करने से वोट नहीं मिलते हैं. There is an ideology that I strongly feel, because have they worked on education anywhere in the country? Can you think of one school system that they have completely transformed? They have been ruling in like Gujarat for 30 years, from Madhya Pradesh. They will not be able to say that. Pollution पे तो naturally if they believe कि pollution पे काम भी करेगा, वोट थोड़े ना मिलने वहाँ से. हाँ, केजरीवाल को गाली दे दो, say something, make it all about Kejriwal, probably people will believe. And I think one more thing I need to say again, which is more about the science of pollution, that 42 out of 50 most polluted cities in the world are in India.
That's an astounding figure.
That's an astounding figure, and it is a North India issue. And when you talk about NCR, Delhi occupies only 3% of the landmass of NCR. The remaining 97% पे आप बात ही नहीं कर रहे हो. Every time कि नहीं दिल्ली ने क्या किया, and I've told you, and I write in my book, I think one of the longest chapters is on air pollution, to tell people that here's a government that is truly committed to doing it.
At least attempting to do something. Whatever.
Attempting to do it, has done it, the bar has moved, but there seems to be no accountability towards the national government and regional governments of Haryana and UP on pollution. And I think that's why we are not seeing a huge change over the years, and only incremental.
And also, talking about that, if we move on to EVs, and actually because Delhi has been promoting electric vehicles in a huge way.
Yeah.
And I believe the maximum number of EVs purchased and the systems are put in order in Delhi. Yeah. Now, my question would be that if you move out of Delhi, because a vehicle is it's an expensive purchase.
Yeah.
And that even if your previous vehicle is, say, fit enough to drive, but there's a compulsory, if it's a diesel vehicle, then
10
I believe
years.
10 years and 15 years if it's
15 years,
petrol.
yeah.
So don't you think it's actually a wastage coming from a responsible party like AAP, which believes in, saving resources and using, green energy and everything?
Yeah.
Do you think it's not a wasteful spend that the common man has to bear? Also, it's expensive to purchase a new vehicle.
I agree. And let me tell your viewers that this is a decision not that AAP has taken. The Supreme Court, the Honorable Supreme Court, has imposed this deadline that in 10 years you have to get rid of your diesel vehicles, in 15 years. I believe all of these should be as per emission standards, right? You define a very high bar for emission standards, but people, or let's say good cars, good petrol cars, if they are maintained well, and if they are BS6, now we're talking about BS6 fuel and engine, and if it is meeting the emission norms even after 15 years, you continue running it. That shouldn't be a problem. But yes, you should incentivize a shift towards electric vehicles, which we have done. And I draw hope from some of the decisions we have taken, which I believe few countries or few cities around the world have taken. And I think your viewers ought to know that last year we announced a delivery vehicle aggregator policy, as per which maximum commercial vehicles in the streets that you see today are either doing last mile deliveries, either food delivery or Amazon, Flipkart kind of a delivery, or cabs, Ola, Ubers of the day. Now, they are the ones which are running almost the entire day, 200 kilometers, 300 kilometers. We have taken a decision, Delhi is the first state to take a decision to mandate 100% shift to EVs for all these commercial vehicles by 2030. It's a law, it's a policy. And all of them have signed up to it, and there are year-wise targets. By 2025 is the first 10% shift needs to happen, then 25, then 50, then 100. So all of these decisions have been taken, and you will see. So it's a longer game. We are already doing it, but immediately when you ask the question, what is UP doing? What is Haryana doing? Nothing. Zero. It's not even a conversation. The chief ministers are not talking. The prime minister is not talking. And when they speak, it's all about blaming Kejriwal.
Also, there's a very surprising factor that you mentioned in your book, that Delhi basically has only 11% of working women.
Yeah.
That's a really surprising...
So that's what, I remember, when the free bus rides for women was announced, a lot of people, even I would say from the liberal sections of the society and political parties also were like, oh, ye to aur ek freebie de diya and all of that stuff. When we asked that, and this is data, the participation of women in the labor force is only 11% in Delhi. The other metros are not doing that great. Maybe it will be 15 to 20%.
But Delhi is the lowest?
Delhi is the lowest. But the fact is that across our urban areas, I mean, most of the places in the world, you will see that rural areas, women participate more, urban areas, it's higher. In India, it's reverse. Seems like we are more regressive in our cities than we are in rural areas where women usually participate in agriculture.
Why do you think this is?
See, one could be social or cultural norms. Second, I feel maybe our
Do you think safety is a factor?
safety is one factor, definitely, but I also feel that our workplaces and our companies don't probably have the right kind of gender sensitive policies. That could be other factor. The question is, the government needs to ask, what can I do to push the bar? And when we ask this question to ourselves, are we doing enough? We thought that let's at least break down the barrier of mobility. Many women, and you know, a lot of researchers will also say that many women take their decisions to work or not to work based on whether can I find something close by my home. And if I don't find, I'm not going to go 10 kilometers away. Also because who will pay for my travel?
Finances are
And
controlled by the male
second,
members.
it's also a function of safety. By making buses free for women, that cost angle has been completely taken away. Second, when women travel together, there is a sense of safety. And the numbers tell you, do you know, when we launched this policy in 2019, only around 20-25% of all our passengers were women. Today it is 50%. Women in Delhi are stepping out of their homes in record numbers that we have never seen. And obviously they are going somewhere because they have something. It's either to access an education opportunity or a work opportunity. And I think that is the power, that small scheme, it doesn't cost much. But I think it goes back to political ideology. Are you willing to do something new to make it easier for women to participate in the economy?
Okay. So I'd like to also ask you, since we're talking about women, there's also in the limelight that the Mahila Samman Yojana,
Yeah,
basically, which
yeah.
promised about 2,100 to women, and it's not been delivered. To
No,
any-
2100 has been an announcement now in the run-up to elections.
But why around the time of the elections? Why not earlier?
No, so I'll tell you the backstory of this. We announced this for the first time in March this year. It was part of the budget of Delhi government. And we said at that time the amount was 1,000 rupees per woman every month. And we knew that normally a scheme like this, because it's a massive scheme, around 40 to 50 lakhs women are going to be enrolled in it. So we had estimated maybe by September, it will take us 6 months to design and launch the scheme. And that was the announcement that was made at that time. Now we all know what happened between March and September.
So also, where's the money going to be coming from?
I'll come to it. Your question was why now, right? So I'm answering that. When we announced it, immediately after that, Mr. Kejriwal was imprisoned, right? And those 6 months were the toughest months for the government. A lot of attempts were made to derail not just this, but many other schemes. So yes, instead of launching it in September, the decision finally did get taken in December. The cabinet has cleared it and the registration has started. So very clearly, I mean, 1,000 rupee scheme is already under implementation. We announced just a few days back, based on what people were telling us and women were saying us, that 1,000 रुपए कम है, महंगाई बहुत ज़्यादा है, there is inflation and a lot of other things, ज़रूरतें ज़्यादा है. So we said yes, you know, we will increase it. And we looked at our finances and what can Delhi afford,
Yes.
because it's a question of that. And we
And
figured that
sustainability when it comes to
absolutely. And we decided that yes, we can afford 2,100. And it is going to be, I can tell you that in the name of women empowerment, in the name of helping women access better education and job opportunities, it is going to be a kind of a Brahmastra. It is a scheme that is going to impact the lives of so many women. I mean, college girls not being able to, you know, buy textbooks or afford, tuitions, or, even women, elderly women, for their needs or for their children's needs. I think it's going to be transformational. How is Delhi going to afford it? Just how we have been able to afford everything else today. And we've not talked about the fiscal prudence bit much, but Delhi today has the lowest debt in the nation. So if a Madhya Pradesh with a debt to GDP ratio of 30-35% can afford a scheme like this, Delhi, which has 10 times less debt, which is 3.5%, can certainly afford it.
So also, the center seems to accuse AAP of basically not implementing the Ayushman Bharat Yojana. What's your response to that?
My response to that is that Ayushman Bharat Yojana is naam bade, darshan chote. It's a very ineffective, it's a very limited scheme. And it has certain clauses by which if a state signs up to the scheme, then it has to put aside a lot of its existing schemes. Now, I elaborate about what the Delhi health model is. Delhi health model is 10 times more effective than in the Ayushman Bharat Yojana. I'll give you one data point. Because Ayushman Bharat Yojana, there is so much of propaganda around it. Under the Ayushman Bharat Yojana, the government of India spends 6,800 crores only every year as a budget for 140 crores Indians. You know how much money the Arvind Kejriwal government in Delhi spends under its different health schemes for the 2.5 crore people of Delhi? 9,000 crores. We are spending 9,000 crores for the healthcare of our 2 crore citizens. And एक scheme जो 6,800 crore खर्च कर रही है for 140, they say it's much better. It only covers, first of all, it only takes care of the poor sections of the society. Your monthly salary needs to be less than 20,000. For a family income needs to be less than 20,000. You shouldn't have a two-wheeler. You shouldn't have a fridge. Otherwise, you're ineligible for Ayushman. So when we applied it in Delhi, we figured that not more than 5 to 6% of the population will really benefit. Second, it has a capping of 5 lakh rupees. And this is only for tertiary. Ayushman is not valid for primary healthcare at all. We have mohalla clinics that provide world-class primary healthcare. We have government hospitals, which are catering to all, rich or poor. Plus, Delhi government is the only government that has a guarantee scheme that if you go to a government hospital and let's say वहाँ पे आपको tests नहीं मिले या waiting period is too high, or for a big surgery like say a cancer or a heart bypass surgery, if the waiting period is too large, and if it is more than 30 days, you can get your treatment done at any of the empaneled private hospitals and the government pays for it.
So you're saying it's basically not as efficient as the Sanjeevani Yojana.
No, I'm talking about the existing healthcare model itself is far, far better. Now what we have launched is this Sanjeevani, not launched, we have announced it will be implemented once a new government comes to power. Now that, you look at the vision and the scale of what we have promised. Ayushman Yojana, under Ayushman, they've just added this component that for elderly people above 70 years, they will be covered. But only up to 5 lakhs cover. That still holds. Under Sanjeevani Yojana, we are saying that no income limit, first of all. Everybody is eligible. All elderly above 60 years eligible, and there's no cost capping. If you have a very expensive, even a surgery like cancer, you spend 15, 20, 30 lakhs, the government will bear it. So our schemes cater to a lot more people of Delhi. In fact, everyone. It is actually universal health coverage. Ayushman is a very limited scheme, and as I said, naam bade darshan chote.
Okay. And what are your views on the Prime Minister?
What are my views on the Prime Minister? I think he has a mandate which few Prime Ministers in the history of India have. I mean, this is a third term, but unfortunately, he has squandered most of his time fighting opposition parties, unleashing ED, CBI, and doing very little that will actually take India in the direction of a developed nation. And I'm not saying this because I'm a member of AAP. I talk about how has India changed in the last 10 years. India's Human Development Index ranking, I mean, at the end of the day, one is to say GDP dekh lo. And yes, in GDP terms, we have become the 5th largest nation. But what matters to the average Indian is the per capita income. On that front, we have stagnated. We rank at 160 out of 180 countries. In the last 20 years, we have stagnated. But the more important welfare measure is the Human Development Index that tells you about the overall health, education of the people of country. Our rank in 2015 was 130th. Today, our rank is 134th. हम बात करते हैं विश्व गुरु बनने की. Think about the countries in our South Asia, region that have moved beyond India, moved ahead of India. Today, Bangladesh ranks higher than India in Human Development Index. Sri Lanka does. China does. Bhutan does. तो मतलब हम अपने neighborhood में ही number 1 नहीं बन पा रहे हैं, and we are talking about a Vishwa Guru. And we talked about inequality. Inequality has increased. We are right now seeing a jobs crisis. We are right now seeing a wage crisis. The average wage of the people of India are not increasing. But one section is really doing well. And that is the rich, the top 1%, where I talk about, 15 lakh crores of loans being written off. The largest corporate tax cut being given in the history of India, which has not resulted in more jobs, but it has resulted in record profits of corporates. So that is where I think the trouble is. That is where I feel the country and the Prime Minister has squandered a brilliant opportunity.
Okay. So also if we talk about the waste management system in Delhi, that has been a bit of an issue, and that's something that AAP has seemed to be struggling with. What do you think is the reason, and how do you intend to fix it? Especially looking at the
Yeah.
Rangpuri Pahadi.
Yeah, it came
Yes.
into the news just a few days back.
Yeah.
So let me first say that the Delhi model of governance, I talk about the track record of the state government and what we have done at the state level. The solid waste management comes at the municipal level. The AAP has come to power only 2 years back, and if you think about it, the 15 years before that, BJP was ruling it. The number one responsibility of the municipal corporation is Saf Safai, solid waste management. What did we see in that 15-year period? That Delhi's was full of garbage landfills. Our landfill mountains were increasing. In the last 2 years, and you would have noticed this if you pass by the Ghazipur or the Balaswar,
yes.
it has actually reduced. Okay, all of them have come by half, and we are on track to actually completely eliminate these landfills for the first time in Delhi's history by the end of next year. We are just 12 months away from that. Door-to-door collection, there's a lot of work happening, I would say, because the system was mismanaged for such a long time. Give 5 years for the AAP government in MCD. Many of these reforms that I told today, I could write about Delhi model because we've spent 10 years in government. We have done 10 years of reforms, and that's why we've seen a sea change. I would say it will not even take 10 years for the MCD. Give it 5 years, and you will see a sea change in the solid waste management.
All right. Thank you so much for joining us for this podcast, and I wish you the best of luck for your book.
Thank you so much. My pleasure.
If you like this episode, then please remember to like, share, subscribe, and comment on our videos. Thank you.